All right. Welcome to the newest episode of Fish Slapped. I am your host, Jeremy, and I got some crazy news for you listeners. We actually were able to acquire a state-of-the-art Ouija board off of Wish, and we're going to try it out tonight because I'm hoping to pull up some heavy hitters from healthcare's history to discuss some pretty important topics today in healthcare, like like transformational leadership, or maybe even health disparity if we have the time. So let's see what happens here, and all right, looks like we've actually got our first guest. Go ahead and introduce yourself for us.
Hey besties, my name is Nurse John Dela Cruz. I'm actually alive and well. I'm widely known as Nurse John on social media, but I have a BSN, which is a Bachelor's of Science of Nursing. I am a content creator, I'm a nurse, and I'm an educator. I have a lot of experience in the bedside nursing, as in med-surg. I use my public role to create skits about various healthcare professionals and raise awareness about nursing burnout, teamwork, patient safety, and workplace culture.
All right, great. Well, sorry about that error. I didn't realize that you were alive. I thought the intern had cleared all these people, so sorry about that. Next guest, what do we got? Who are you?
I too am alive, and I believe that that's probably what you get when you buy a Ouija board off a Wish. But my name is Dr. Rochelle Walensky. I'm the former director of the CDC. I specialize in infectious diseases, and I'm currently a professor at Harvard Medical School.
Wow, okay. All right, 2 for 2 on the incorrect thing. Hopefully, number 3. Please tell me you're dead.
Also alive. My name is Professor Dr. David Cutler. If you would have shopped that, Timo had a better price on Ouija boards than Wish.
Oh, of course. I just have a really hard time jumping from one app to another. You know, like when I think of paying for things cheaply. Yeah, probably. I mean, I don't know. Well, not worry about it.
Target where I go for self-esteem versus Walmart.
Correct. If you want to feel good about yourself, one is better than the other. That's for sure. All right, so tell us a little bit about yourself. What do you do? What's your contributions to healthcare?
So, again, I'm Dr. Cutler. I'm a healthcare economist at Harvard. I work in economy for the healthcare department, but I also have served on numerous presidential campaigns and different economic councils through the lens of healthcare and trying to eliminate healthcare disparities.
Okay, terrific. All right, great. Thank you. Okay, so let me see here. All right, first order of business, guys. We're going to talk about the concept of transformational leadership, okay? So go ahead and take a second here to kind of start stewing over what that means to you. And so we're just going to have everyone pop out an idea of what you feel about transformational leadership. You take it away.
Transformational leadership, oh bestie, that's when your leader actually inspires you instead of just hiding in the office with snacks. They motivate, listen, and help you grow, and not just survive your 12-hour shifts. It's giving, let's grow together, not do more with less, period.
Wonderful, thank you. All right, who wants to take the next one?
I mean, Nurse John isn't wrong. It is really about inspiring people to make real change and work together toward a better future, but you can't knock the snacks.
Okay, fair enough. All right, any additional opinions we want to throw in the mix?
Completely agree with the other two. Transformational leadership about inspiring others. Sometimes our job is not to be the face of that inspiration, but it's to be the supporting cast through our technical expertise, like on a presidential council, and how that transmits to the nation at large through that medium.
Wonderful. All right, that's a good point. That we have to think about things for both at the macro and micro perspectives. Okay, talking about something else that definitely impacts large groups of people. Let's look into health disparity. All right, who wants to give me a rundown of what health disparity looks like or what it is?
Oh bestie, I think health disparity is when certain groups of people, because of their race, income, where they live, or who they are, don't get the same chance at good health care. It's like when two people show up in the ER, but one gets treated faster or better just because of their background. And it's giving not fair, not equal, and definitely not okay, bestie.
Okay, sorry. I was born when the decades used to actually have an 8 in it, so I'm going to have someone else explain to me exactly what you just said. Dr. Rochelle, could you throw something my way that sounds a little bit more understandable?
I think what Nurse John is trying to basically say is it just comes down to things like where you live, your background, your income, things outside of your control that'll make it harder for you to stay healthy or get the help that you need.
Oh, okay. Yeah, that's pretty serious then. Any other opinions or takeaways on that one?
What Dr. Walensky was saying, I would like to echo as far as folks that may not have as much disposable income. If we could have transparency in healthcare and allow them to make informed decisions about their healthcare through the lens of price, if we assume that all other aspects are standardized, that would be eliminating a barrier to care and trying to remove some of the veil of healthcare disparities.
Okay. All right, terrific. Okay, so let's take a second here and we're going to combine some ideas. So each one of you, I'd like to kind of have a quick answer from you on this one. So let's take transformational leadership attributes and how would they be used in addressing those identified health disparities?
One way to do that is to advocate for equitable vaccine distribution.
Okay, terrific. Okay. Anyone else have a feeling on that?
So through the lens of healthcare economics, we would take that equitable vaccine distribution. We would look at the efficacy of that as far as how that translates to a lower occurrence of COVID-19 admission, and how that looks through many different populations and their different comorbidities or economic statuses they may have.
Right. Yeah, I can see that.
I agree with both of them. They have very good points and very, very nice perspectives. I think it's just, as a prepared nurse, I just think it's about more than just passing meds. It's about seeing the bigger picture. So when it comes to health disparities, I think I can use my voice to advocate and educate and inspire that change. Whether it's helping underserved patients or challenging bias in care, I don't just follow, I lead with my heart, and that's what my BSN trained me to do.
Great. What a great way to wrap up that particular question. Thank you. All right, so we've got one more final question here from the chat group. So they would like you guys to address how identified disparity was impacted by leaders via increased access to and or the distribution of healthcare. Who wants to go first?
I'll take this one. In our whole thing with COVID-19, we focused on bringing these services directly to the neighborhoods. And by services, I mean treatment, vaccines, testing. We basically brought it to the people versus waiting for the people to come to us. And that is how we closed the health gap, quote unquote.
Okay, terrific. Anyone else have any other input that they'd like to share?
So again, as a healthcare economist, we would look at this through the lens of what Dr. Walensky's work was and the efficacy of it. Did it decrease admission rates for COVID, and did it decrease barriers to care or increasing access, i.e. we had more patients at those shot clinics or open house COVID inoculation events. If we had an increase in participation and a decrease in admission, as a healthcare economist, we would consider that to be a win.
Okay, terrific.
I noticed some patients from underserved communities who were missing care because of money, language barriers, or transportation. So I teamed up with leaders to set up mobile clinics and organize health education events right where people live and bring interpreters to where people actually lived and worked, along with advocating for flexible scheduling. It's about breaking down those walls and making healthcare easier to reach for everyone. No one left behind. That's how you increase accessibility and start closing those gaps.
All right, terrific. Well, I want to thank you guys all for getting here. I don't know how this Ouija board works. I know that you guys didn't obviously just walk into the room, or maybe you did. I don't know. So either way, I just want to thank you guys for taking time out of your busy day to help share and illuminate, I guess, the public on how we can really look at these big picture concepts. So thanks again for coming, and you guys have a great night.